1 in 5 Americans visit the ER at least once per year. Now one family is speaking out after they felt they were charged without ever receiving emergency room treatment. 9-year-old Brianna's mother was teaching her how to pump gas when gasoline splashed into her eyes. Her mother immediately took her to the gas station restroom where they flushed her eyes, and then, fearing a chemical burn, reportedly her parents took her to the hospital where they claim a doctor didn't get within 6 feet of her and instructed the mother to wash out her daughter's eye in the sink. The family later received a bill for, in total, I believe it was $1,400 in 2 separate bills, one from the hospital, one from the group providing the services. And the family, I guess, was also told the eye wash station was too unsanitary for use, so they were sent to a regular sink and told to rinse their daughter's eyes for 20 minutes. And I think, Lisa, while you're still with us, I'm curious, because one of the things that they're complaining of is this idea of upcoding or upcharging. You know, how you can go to a hospital, rinse your eyes out with water in a sink and be billed $1,400. Can you address this upcoding and when it can become a problem legally?
Well, there's a lot of issues with the upcoding because now you're engaging at a federal level, and I think that there's treble damages in most cases when they get caught for the intentional upcoding. But the hospital is liable in a situation like this, and people are going to look at it and they're going to have some consequences for it.
And I think this is where there's a huge disconnect between physicians and billing, and I'm just going to be quite frank in that regard. And I hate the fact that even when I go to see a doctor, or we've talked about on the show before when I had my surgery, I didn't understand the bills that were showing up. Some of them seemed really high. It was confusing. But the one thing I will say is that you should always have a thorough evaluation. I have never in my life, never one time have I ever stood 6 feet away from a patient and said I examined them, ever. So that's unforgivable.
As a mom taking a child into the ER, which has happened to me. I've taken my daughter in for trauma. And I think when you're that scared and you're that worried, you always still have to keep a level head, because if you feel like you're not getting the adequate attention you need, even if there are 5 other traumas going on, I think it's really important to make sure that you voice that to the nurse before you leave. Voice that to the PA. Say, you know, the doctor really only was 6 feet away from my kid, and I don't really feel comfortable. I don't think like she was adequately assessed. And at the same time, I think if you do get an EOB, an explanation of benefits in the mail, that this was charged to your insurance, you have every right as a patient and as a parent to review those charges and make sure they're accurate and make sure that what they're saying was done was actually done.
Lisa, it sounds to me like in a case like this, is it really more about the fact that the upcoding occurred, or these patients are getting these bills saying one thing happened when they didn't?
Yeah, that's the biggest issue here. And the harm that may have happened to the family is only if they paid that bill. So in this case, as long as the family hasn't paid the bill, there's really no injury, quote unquote, on their side. I think that the bigger injury is to the public, because when you get these stories that go out in the media like this, then people start to distrust the healthcare system, and it erodes the whole purpose of why you have doctors like you in the ER there to help us when we need it. And to me, it's simply, in this situation, it sounds like it was a mistake. It wasn't probably intentional. And again, I would just implore the audience and the public to understand that this is a sanctuary for you to go and get help. We are in a country that has the best healthcare in the world, and upcoding on bills is merely, in this situation, a mistake that can be remedied.